Hi, I'm Dr. Tammy Penhollow of Precision Regenerative Medicine. So many times I get asked a question about steroids, and I want to let you know that steroids are not benign. So a steroid is like when people say get a cortisone shot in my shoulder, or they've been giving me steroid shots in my knees. They can be injected pretty much anywhere, right? In the old days, people would go to their general practitioner and they get a shot intramuscular into the hip or into the glutes, and that would just kind of help them feel better all over. They get a little zest, a little pep, a little increased energy. But again, steroids are not benign. So I wanted to make a video very specifically about the steroids because I quit traditional pain management. I stopped doing steroids. I used to inject steroids into knees, hips, shoulders, elbows, wrists. I've seen people do it into the carpal tunnel. I certainly did my fair share of epidural steroid injections into the cervical, thoracic, lumbar spine, and people might get a little bit better for a little while. Steroids do decrease acute inflammation. They might have a role. I will say I don't use them, but some people do get benefit in the operating room, for example. When I'm doing anesthesia and we're doing a big surgery on the nose or into the sinuses or around the airway, and the surgeon asks specifically for me to give some IV steroids so that it will decrease the likelihood of swelling around that airway so that the people can breathe after their sinus surgery. It can also be an anti-nausea. Some people have steroid as part of their chemotherapy treatment because it tends to make that chemotherapy drug work better and fight their cancer. So I'm not saying there's never, ever, ever a role for steroid. If you fell into a patch of poison ivy and you were red from head to toe and they needed the steroid to calm down your body's immune response, I get it. But when we're talking about using it in pain management, in musculoskeletal, in sports medicine, steroids are destructive. They may temporize, they may put a little band-aid on that swelling acutely, but guess what? It's not going to cure anything. It's not going to allow the body time to heal during that period. The steroids have been shown to increase your risk for having a tendon rupture. And a lot of people say, oh, well, I just put it into the joint. It didn't go around the tendon. For example, they put it in the elbow rather than at the lateral epicondyle or the medial epicondyle for golfers or tennis elbow. But we've seen the tendons rupture with the steroid in and around that area. Similar, steroids destroy the cartilage. That's that kind of coating over the bones. When we talk about in the knee, for example, where we've got these two surfaces where there's a cartilage over this portion of the lower leg, there's a cartilage over this portion of the femur, and that wear and tear is what happens, and then people eventually get to be bone on bone because the cartilage has been completely destroyed. Well, guess what? People who get steroid injections over and over again have faster degradation and destruction of that cartilage, so they're actually more likely to end up with a joint replacement earlier than if they'd done something where they were able to strengthen the muscles around the knee, where they were able to make sure that their weight was appropriate, that their muscles were strong. They maybe even use their own cells, like their platelet-rich plasma, their alpha-2 macroglobulin, or their bone marrow aspirate concentrate to use those mesenchymal stem cells, signaling cells. So that's just the cartilage, that's just the tendon rupture portion. But then there's this systemic effect of steroids. You do a steroid injection, or you take a Medrol dose pack where you're on a steroid higher dose for some days and drop down for some days and drop down. That actually decreases your body's ability to fight an infection. You're more at risk to get an infection. You are at increased risk for cancer. It also suppresses your body's ability to make its own steroids. Once your body's seen a whole bunch of outside steroids, people who take steroids every single day by mouth or inhale steroids in their inhalers for their COPD or asthma, everybody has little glands on the top of their kidneys called the adrenal glands. And when the adrenal glands, who normally make corticosteroids, sees that the body's getting steroids from an outside source, they say, okay, I don't need to work anymore, and the adrenal shut down the production of steroids. So then that can be bad too. I mean, we've got our own circulating corticosteroids that serve so many purposes for regulation of a lot of different body things, but it's the exogenous or outside steroids that are bad. Additionally, it can cause havoc with people trying to control their blood sugars. It increases your risk of having huge spikes. Some patients who would get steroid injections into their epidural space would tell me that for 60 to 90 days, their blood sugars were completely unmanageable. Similarly, I've seen so many people who say, I started gaining weight the moment I got steroids, and steroids it's all part of this cortisol release, this stress response. So there can be weight gain, there can be blood sugar difficulties managing, your body can shut down its own production of steroids. You can have a lot of other effects, like the inability to sleep while you're on the steroids, because there's almost this mania, inability to focus. People just don't like it. They can even call it a steroid psychosis. Certainly then the changes in the musculoskeletal system, like the cartilage destruction, needing to have a joint replacement sooner, tendon rupture, needing to have a surgical tendon repair. So if people ask me if I will give them steroids, the answer is no. I want to heal your body. I want to optimize you through all these different things, these pillars of your well-being with your eating and your fitness and stabilizing those joints, and then using your body's healthy cells because you're anti-inflammatory eating and all these things. You're optimized. I want to use your body's own cells to help get you back to all these activities. Steroids are a band-aid. We're looking for something that's not a quick fix. So if you have any more questions about this, please reach out. Look forward to speaking with you. Our number is 602-806-7389. Thanks again. To your best health.